Welcome to this explainer. Ever wonder how you actually cure a medical desert? Well, today we're going to unpack a truly fascinating story of regional transformation. We're looking at how a severe medical vacuum in a pretty geographically challenging area was decisively solved by the creation of Mohtarma Benazir Bhutto Shaheed Medical College, or MBBSMC for short. It's really a masterclass in how targeted state infrastructure can completely reshape the socioeconomic and health landscape of an entire region. Let's get into it. So here is our roadmap for today. Number 1, a regional medical crisis. Number 2, founding the institution. Number 3, the academic blueprint. Number 4, life as a medical student. And finally, number 5, global and regional impact. Starting off with Section 1, a regional medical crisis. The pre-2012 healthcare vacuum. Picture this for a second. Imagine you desperately need specialized healthcare, but the nearest consultant is literally hundreds of kilometers away across these incredibly treacherous mountain roads. For decades, the people living in the southern divisions of Azad Jammu and Kashmir, specifically around Mirpur, Kotli, and Bimber, faced this exact harsh reality. If you needed a specialist, say a radiologist, or access to a modern surgical unit, you had to make a grueling journey all the way to Muzaffarabad, Islamabad, or Lahore. The stakes here were just massive. Before 2012, there was only one public medical college in the entire state, and it was located far up north. The main hospital in Mirpur was massively understaffed, and if you were a local student dreaming of becoming a doctor, well, you were forced to compete for a microscopic quota of seats in provincial universities elsewhere in Pakistan. It was a systemic failure, really, leaving a whole region dangerously neglected. Moving to Section 2, founding the institution. From borrowed rooms to a permanent campus. Now, what's wild about this timeline is the sheer undeniable willpower on display. To avoid delaying the education of the region's top students, they didn't just sit around waiting for a fancy purpose-built campus. No way. In 2012, they opened, immediately using primitive, borrowed government rooms right in New Mirpur city. During those gritty early years, faculty and students had to survive regular, high-stress surprise inspections from the medical council just to keep their provisional registration. But their hard work paid off. By 2017, they earned a massive, state-of-the-art permanent campus overlooking the Mongla Dam. And by 2024, they had expanded into a full-blown university hub offering nursing and medical lab technology. And the government really wanted to make a statement here. The college was named after the former two-time Prime Minister of Pakistan, Mohtarma Benazir Bhutto. It wasn't just a name slapped on a building, it was a deliberate political signal by the leadership at the time. It sent a clear message that expanding public infrastructure and higher education in these semi-urban areas was a supreme national priority. Basically, a strategic scheme directly targeting localized healthcare disparities.
All right, Section 3, the academic blueprint, the anatomy of medical training.
So, how do you actually build a doctor from scratch? Well, the curriculum here acts like a very strict two-step ladder. Step 1 is the Basic Medical Sciences Division. That's your first 2 years, covering 7 distinct foundational departments. Then, Step 2 is the Clinical Medical Sciences Division. That covers the final 3 years across 10 major specialized departments, totally shifting students out of the classroom and directly into active, fast-paced hospital facilities. It's literally a transition from the quiet of the lab to the chaos of the ER. Students start out in heavily theoretical main campus blocks, spending hours upon hours in anatomy dissection halls and physiology labs. But then they transition straight into the high-stakes, real-world environment of the teaching hospital. We're talking a 400-bed facility, completely outfitted with intensive care units, neonatal wards, and active surgical trauma suites. It is hands-on, and it is intense. To actually pull this off and maintain such intensive training, the state leans on a rigid civil service hierarchy. It's structured almost like a military unit. Everyone from the principal down to the ward demonstrators operates on the government's basic pay scale framework. In fact, to make sure top talent stays completely focused on the undergrads, the state offers a specialized non-practicing allowance. Basically, they pay these elite doctors extra to not run private evening clinics, ensuring they're 100% dedicated to this academic blueprint.
Which brings us to Section 4, Life as a Medical Student. The daily grind and discipline.
75%. That's the magic number. Actually, scratch that. It's not magic. It is a strict, legally mandated minimum attendance threshold for both lectures and labs. If you miss this baseline, you are barred from sitting for your professional exams. Period. No exceptions.
The daily rhythm is just relentless. Lectures start sharply at 8 a.m., and by midday, you're transitioning directly into clinical clerkships under the hawk-like surveillance of senior consultants. But here's a massive upside: the financial grounding. Because this is a state-funded public institution, tuition is kept incredibly accessible compared to private colleges. The elite open merit MBBS program runs about 600,000 rupees annually, while allied health degrees sit at just 120,000 rupees. This setup guarantees that the state is capturing the absolute best minds in the region based purely on merit, not just who has the deepest pockets. Of course, because students are pulled in from all over the territory, residential life is a huge piece of the puzzle. They live in highly secure, separate hostels. One detail I absolutely love is the mandatory mess protocol. I mean, exhausted medical students surviving on their own cooking is basically a public health crisis waiting to happen, right? So a student-elected committee actually manages the grocery procurement and menus to ensure things are hygienic and affordable. And to blow off steam, students run vibrant co-curriculars, especially the Community Service Club, which actually runs free medical camps out in marginalized rural areas. Section 5. Global and Regional Impact. From local solution to international recognition. The results of this intense blueprint absolutely speak for themselves. They didn't just solve a local problem, they literally met global standards. By securing listings in the World Directory of Medical Schools, graduates from Mirpur can now take international licensing exams like the USMLE in the States or the PLAB in the UK. And at the exact same time, they've built a robust local research footprint. They launched their own peer-reviewed journal and have published over 150 papers investigating hyperlocal issues, like waterborne pathogens near the dam or orthopedic trauma from regional highway crashes. Just look at what this single institution has done for the region. They've injected 480 highly trained doctors straight back into the local workforce, completely rewriting the patient-to-physician ratio. With 500 students currently enrolled, it has fundamentally boosted the local economy. Plus, it's provided a massive domestic training alternative for local women, advancing gender inclusivity in higher ed. It effectively took Mirpur, a city historically known mostly for exporting labor abroad, and turned it into a thriving, sustainable hub for medical education. So the final thought I want to leave you with in this explainer is a pretty big question. What can other global medical deserts learn from this Mirpur blueprint to transform their own healthcare landscapes? Because this story proves that with sustained political will, a strict academic structure, and a real commitment to public service, even the most challenging healthcare vacuums on Earth can be filled. Thanks for joining me on this deep dive. Catch you on the next one.